So just to, I suppose, welcome everyone to the Monday's Research Bite session, and also to welcome our speaker today, which is Dr. Laura Bardon. She is currently a postdoc in the UCD Institute of Food and Health, working on the EU Horizon 2020 project Food Nutrition Security Cloud, otherwise known as FNS Cloud. This project has 35 partner institutions across 14 countries, consisting of scientific researchers, IT specialists, and communication experts. Its aim is to generate an online cloud solution to bring together existing and newly developed tools and data sets across the areas of dietary intake, nutrition, and agri-food to facilitate ease of access and promote their reuse. So I'm looking forward to Laura, to hearing all about it, and then to plenty of questions afterwards. So I'll leave the stage to you, Laura.
Great, thanks, Breed. So as Bree said, the title of my talk is Making Dietary Intake Data Fair, the FNS Cloud project. So the FNS Cloud's overarching aim is to overcome fragmentation issues within FNS data by integrating existing data and developing a cloud infrastructure, so a central place where services, data, knowledge and tools to do with FNS, so food, nutrition and food security data can be stored. And this is to overcome access limitations so that there's better understanding and exploitation of existing data, and then to add value to previously publicly funded research through making data more fair. So FAIR stands for findable, accessible, interoperable, and reusable. And the principles of FAIR underpin data reuse and act as guidelines for data holders or researchers to put data in a position to be reused. So we know at present there is only limited numbers of kind of large scale pan-European dietary intake data sets, but there's many, many smaller and more focused data sets that exist. So using FAIR principles, they're hoping to ensure the interoperability and merging of available data sets to answer overarching research questions that will enable greater assessment of health and health-related outcomes from existing food, nutrition, and health data sets. So within UCD here, we are interested in the researcher journey, I suppose, through FNS Cloud to highlight how it will be of use to researchers like us going forward. And there's a number of steps within this. So first of all, a researcher will usually come with a research question that they wish to answer. And we've chosen an example one here. So they may have some existing data they want to use, or else they may want to look for further data sets, either to add to this or look for data sets on their own to answer that research question. So we need a central place to find the data sets, and they will use the FNS Cloud catalogs, which are essential, I suppose, like the yellow pages, to look for data sets there, which are relevant to their specific research question. Secondly, they'll have to read the information on each of those data sets to identify potential data sets containing parameters of interest. Then, of course, they're going to have to determine if those data sets are actually suitable to answer their research question, if they're appropriate for the research question being asked. They'll then have to obtain access to the data sets. And then finally, they have access to FNS Cloud tools and services to facilitate in the mapping and merging of different data sets together before they can then come away from FNS Cloud and do their statistical analysis themselves. So before we dive into that, I'm skipping slides, there we go. We know there are many different methods of measuring dietary intake data, and that to accurately assess dietary intake data, that's a challenge. So the most commonly used methods are food diaries, 24-hour recalls, and food frequency questionnaires. So I'm just going to go through this briefly, as I know most of you would know all of this. So a food diary is obviously a prospective method, meaning that foods and drinks are recorded at the time of eating. Individuals then can either weigh their food or else estimate their portion sizes using descriptions. And then these food diaries usually take place over between 3 and 7 days. Next up, you have 24-hour dietary recalls. It's a retrospective method, and it's where users usually recall what they ate and drank during the previous 24 hours. To increase accuracy, there's often multiple recalls are completed. And traditionally, these are interview-based, and they follow a defined protocol to limit things being forgotten. and protocols such as the multi-pass method are often used. Then finally, there are food frequency questionnaires. So these retrospectively record habitual diet over a longer period of time, usually between a month and up to about a year's time span. And these FFQs, they all differ. They often include between 20 and up to 200 different food items and drink items. And the food items vary between FFQs and depend on whether it's designed to give an overview of the whole diet or is more focused on a specific aspect. So with FFQs, portion size is either not quantified or else only estimated using general portion sizes such as small, medium, or large. So diet diaries and 24-hour recalls, they record information at that individual food level, plus the FFQs tend to focus more on food groups. So we know that we have different methods for collecting data, which lead to variability in terms of both the level of detail of the food information collected and also on the portion size information collected, how detailed that is. So once we have this information, regardless of the method that was used to collect it, we next need to combine it with composition information in order to generate individual nutrient intakes. So we know that food composition data will give us detailed information on the macronutrients and micronutrients of a specific food item. So we've discussed why the description of the food is important. So regardless of how the data was collected, it will all boil down to the same thing. Once we combine it with nutrient information, we'll get the same outputs, even though they've been collected very differently. So that brings us to our first solution within FNS Cloud, where we look at those methods of collecting data. So those methods of collecting data are traditionally done in kind of paper-based methods or interview-based methods. However, we know that there's more and more novel tools out there which are doing these same methods and based on the same methods, but doing them online. So within FNS Cloud, our first solution in terms of improving access to data and improving collection of data was to further develop some novel tools for assessing dietary intake. And these tools are based on diet diaries, such as the Libro app, food frequency questionnaires, such as the eNutri tool and the What I Eat 60+, and also on 24-hour recalls, Foodbook 24. So within UCD, Foodbook 24 was further developed to collect data from a range of different nationalities living in Ireland. So the tool was translated and also the food list was expanded to incorporate foods that are commonly eaten by Chinese, Polish, and Brazilian people. And this was done in order to, I suppose, expand the scope and expand the reach of these tools, as we know that different nationalities are often poor responders or don't tend to participate in dietary surveys. So we've looked at the challenges in terms of collecting dietary intake data and how FNS Cloud has focused on the expansion of some existing online tools to facilitate researchers with the collection of new data. So next we need to consider dietary intake data sets that are already in existence across Europe and even further afield, and the challenges which lie within these. So we know that they may exist in different languages or have different colloquial names for describing essentially the same kind of foods. By way of example, what we might refer to as barnbrack here in Ireland could be simply known as fruitcake elsewhere. And there's also many other examples of similar food items. On top of this, food data is also assigned food codes. However, there's lots of different types of coding systems that can be used to code these foods, such as national coding systems and also systems such as FoodX2. So variances in terms of how the foods are described within a data set, those colloquial terms, and also the food coding causes difficulties when you attempt to reuse data or to combine multiple data sets, as they're not interoperable with each other, which limits their reuse. Therefore, we're in need of tools to support us in the reuse of data. And within FNS Cloud, we're developing solutions to facilitate this process. And I'll go through a few of these now. So first of all, I'm going back to that researcher journey we have within FNS Cloud. So we can find the data sets using our data catalogs, and then we need to move on to assess the quality and also to merge them. So first of all, we have the catalogs. The catalogs exist and you can search using different key search terms, such as by method of collection. So you could look for 24-hour recall. You might be interested in a specific population group. So you can search by adults or type in whatever you want to find different data sets. Once they're found, then you can assess the information given to see if they're appropriate for your research question. And it's just a central place where data sets can be listed and basic information on those data sets exist. There may also be links for how to further access the data or how you can contact the research team to get access. So once we've identified potentially data sets of potential interest, we then need to make sure that these data sets are actually appropriate to be reused to answer your research question. So whilst FNS wishes to promote and increase the reuse of existing data sets, it's very important that alongside this reuse that scientific quality is maintained. So we designed a data quality assessment framework for dietary intake data sets within FNS Cloud. And the idea is to support data users in that decision-making process of deciding whether a data set that they've selected is appropriate for reuse to answer their specific research question. So in order to achieve this, we started off and we did a literature review on the indicators of quality across 4 data domains, being dietary intake data, and then also some of those data types that are often within those data sets, so demographic data, lifestyle data, and also consumer behavior data. And we developed a quality framework in the form of flowcharts, which focus on individual aspects of quality and ask questions about those. And then we developed individualized messages to provide users with additional considerations before selecting a data set for use. So the tool asks a series of questions which the user responds to, and we don't say whether or not that data set should be used. We just give, I suppose, signposts to other sources and give information on what you should consider before deciding if this is a good idea. Then moving on to the next step, once you've decided a data set may be appropriate for your use, you want to then obtain access. And this can be done in a variety of ways, depending on the data set in question and depending on the availability of that data. So some data sets are open access and are free to download. Maybe they might be available on something like Zenodo or through the Global Dietary Databases Network. And then others may require the use of a data sharing agreement where researchers agree with the data holders the scope of the reasons why they wish to use that data set and what they've permission to use it for. And within FNS Cloud, we have developed some templates which can be used to access data in this way. So next, moving on to once you have obtained data and you have data now that you want to link together, we're going to take one of the tools that we have been involved in the development of as an example for how you can then use these tools to merge and harmonize data sets. So we had selected a range of data sets which are coded with FoodX2 as they're all interoperable with each other and they're can be more easily merged together. And then we had collected data using Foodbook 24, which doesn't have FoodX2 coding. And it's a huge manual process in order to assign FoodX2 codes to each of those foods. So we worked alongside colleagues in JSI in Slovenia, where they had a method which could semi-automatically match foods using their just the food description, using the linguistic terms to give potential matches to FoodX2 codes. And using this tool, we managed to semi-automatically match 56% of the foods in our food list to FoodX2 codes. And then we worked to manually match the rest of those foods. So now we have a data set that is coded in FoodX2 and can be linked to other data sets to answer a new research question. It's made the data more interoperable with those data sets. So we went through a whistle-stop tour, I suppose, of FNS Cloud. You have the catalogs where you can find data sets and you can assess whether they are appropriate for use using that quality assessment tool. You have a range of options for accessing that data, whether it be through the development of a data sharing agreement, or else if it's freely available, you can download. And then we've went through one of the tools which can be used to map dietary intake data sets to each other. So I suppose the central component of FNS Cloud is the data catalogs. And within that, we've went through how you can access different data sets through searching. You can also access and look for a range of different tools and services as well, such as the stand food method, which are also listed on the catalogs. And within the catalogs, each resource has a clear access pathway. It has a range of different resources which are there to suit different types of users working in the FNS domain, from consumer apps for collecting dietary intake data to looking at the food chain, and also for mapping tools, so data harmonization tools such as the stand food method, and our data collection tools are also listed within that. So thank you very much for listening. I've presented this on behalf of a huge team. The UCD team is led by Eileen Gibney, as well as having Grace Bennett, Shua Yang, and Mark Lamb on the team. So thank you very much for listening, and I'd be happy to answer any questions.